Hello everyone, it's your next door nurse Florence and you're welcome to another exciting time. Today we're going to be looking into the topic fainting or collapse. We're going to be talking about what it is, its causes, some of the types, when do you determine that person has fainted or when do you determine that fainting is an emergency, and how do you or what do you do to prevent and help someone that faints. To my subscribers, thank you so much for sticking with me, and to the newbies, you're welcome to the family. Kindly subscribe, like and share. Collapse is a sudden unannounced loss of postural tone, often not necessarily accompanied by a loss of consciousness. Fainting, on the other hand, is when one becomes unconscious or blackout for a brief period. The medical term for fainting is called syncope, so I'm going to be using them interchangeably. The major cause of collapse, fainting or syncope is a sudden drop in the blood pressure, which results in low blood flow or less blood flow to the brain. Other causes include being in a hot, crowded or poorly ventilated setting, standing for a very long time, getting up too fast after sitting or lying down, especially if one is tired, dehydrated, has a low blood pressure or low blood sugar, emotional stress like fright, pain, anxiety or shock. Less often, people faint without any warning symptoms, and it's usually not serious. A fainting spell generally lasts for a few seconds to a few minutes. Anemia could also cause fainting. The types of fainting or syncope includes 1. Vasovagal syncope. This involves the vagus nerve, which is the 10th cranial nerve. It links the brain to other areas of the body. It can be triggered by emotional trauma, stress, sight of blood, or standing for a long period of time. 2. Carotid sinus syncope. This type happens when the carotid artery in the neck is constricted, usually after turning the head to one side or wearing a collar that is too tight. 3. Situational syncope. This type occurs due to straining while coughing, urinating, moving the bowels, or having gastrointestinal problems. Some of the warning signs of fainting or the signs and symptoms of fainting include dizziness, weakness, feeling lightheaded, ringing in the ear, that's tinnitus, sweating, having the urge to vomit, vomiting, blurred vision, sensation that the room is moving, and some people become aware that sounds are fading away. The person may collapse to the floor and have a brief period of twitching. And when these individuals wake up, they feel confused, dizzy, or ill for a while. What do you do to avoid fainting? Or what are the precautions to take to prevent one from fainting? If you have a history of fainting, you try to find out what causes you to faint so you can avoid those triggers. Some persons tend to faint at certain times, such as when they are emotionally stressed or when they have their blood drawn or during any other medical procedures. It may help to 1. Sit with your head between your knees or lie down when you feel lightheaded. 2. Drink plenty of fluids so that you don't get dehydrated. 3. Stand up slowly, or better still, do not stand up until you feel better. 4. Do not skip your meals. When do you consider or determine that fainting is an emergency? Fainting may be a sign of a serious problem or an emergency if the person is pregnant, the person has diabetes, if it happens within a short period, if it happens during exercise or vigorous activities, if it happens without warning, or if you're already lying down, if the individual falls and sustains an injury, losing a lot of blood, if he feels shortness of breath or isn't breathing, if the individual has chest pain, pressure, or a history of heart disease, if the individual has no history of fainting and is over 50, has slow or slurred speech, has difficulty with speech or vision, has lost bowel or bladder control, having palpitations, that's irregular heartbeats, or when one feels the heart is racing or beating unevenly, When fainting happens with numbness or tingling on one side of the body or face. When the individual remains confused or disoriented after fainting. And when the individual does not regain consciousness within a few minutes of fainting. How do you help a collapsed person or someone that faints? 1. Do not panic. Check for any danger around you and try to rouse the person by giving their shoulder a hard shake and shouting, "Can you hear me?" 2. Lie the person down by positioning the person on his or her back. Elevate the feet above the level of the heart. 3. Loosen tight belts, collars or other restrictive clothing. Keep the person sitting or lying down for at least 10 to 15 minutes. A cool or quiet place is best. 4. Turn the person on his or her side if he or she is vomiting or bleeding from the mouth. Next, stay with the person until the person fully recovers. To reduce the chance of fainting again, don't get the person up too quickly. If the person does not regain consciousness within 1 minute, call your local emergency number or take the person to the hospital immediately. So guys, give me a thumbs up if you find this content helpful and useful. Kindly subscribe, click on the notification bell so you'll be the first to know when I upload new videos, and don't forget to drop your comments in the comment section below and I will attend to them. I remain your next door nurse and I'm just a knock away. I love you guys. See you in my next video. Bye.